In my 25 years as a doctor, I've seen too many patients discover their pancreatic cancer too late. The symptoms are so easy to miss or dismiss as something minor, until they suddenly can't be ignored. Today I'm going to share the 10 warning signs that could save your loved one's life. Most people miss at least 7 of these subtle symptoms, and that delay can mean the difference between treatment options and having none at all. When Sarah brought her 68-year-old father to my office, she mentioned he looked a bit yellow. What she didn't realize was that this observation might have saved his life. That slight yellowing, which many might dismiss as nothing serious, was actually jaundice, one of the most visible and critical warning signs of pancreatic cancer. Jaundice demands immediate attention because it indicates a potentially serious blockage. This yellowing occurs when bilirubin builds up in your bloodstream because tumors in the pancreas block the common bile duct, preventing normal elimination. Sarah's attentiveness highlights why caregivers play such a crucial role in detection. Unlike subjective symptoms like pain or fatigue, jaundice creates a visible change that others can observe. The yellowing typically appears first in the whites of the eyes before spreading to the skin, providing an early detection opportunity that can significantly improve outcomes. Many families who seek prompt medical attention feel tremendous relief when treatment can begin early. Unfortunately, caregivers often attribute this yellowing to aging, medications, or minor liver problems, missing a critical warning sign that appears before other symptoms develop. You should know that jaundice doesn't always indicate cancer. It can signal gallstones, hepatitis, or other liver conditions. However, when it appears in older adults without a history of liver disease, especially alongside unexplained weight loss or abdominal discomfort, it requires immediate medical investigation. While unexplained weight loss might seem like a welcome change, it's actually one of the most frequently overlooked warning signs of pancreatic cancer. When Mr. Johnson's daughter noticed her father had lost 15 pounds without trying, she was initially pleased. "Dad, you look great. Whatever you're doing, keep it up," she told him during a family gathering. It wasn't until their appointment that I had to explain what this positive change might actually signify. Caregivers need to understand that losing 5% or more of body weight without intentional effort requires investigation. Our weight-conscious society often celebrates any weight loss, creating a dangerous blind spot where warning signs are misinterpreted as improvements. Pancreatic cancer compromises the organ's ability to produce digestive enzymes, leading to malabsorption where nutrients can't be properly processed. These digestive changes often precede noticeable energy depletion as the body struggles to maintain normal function. The gradual nature of this symptom makes it particularly deceptive, like sand slipping through fingers rather than falling in a heap. Weight drops slowly over months, making it easy to overlook until substantial loss has occurred. This is especially problematic in older adults who experience natural weight fluctuations with aging. For effective monitoring, keep regular weight records rather than relying on visual assessment. A simple bathroom scale and monthly checks can reveal concerning patterns before they become severe. Beyond tracking weight changes, there's a deceptive symptom that hides in plain sight, pain that's too often dismissed as routine indigestion. When Mrs. Chen described persistent upper abdominal pain radiating to her back, her family reached for antacids, unaware that this specific pain pattern might signal pancreatic cancer rather than common digestive troubles. This particular symptom deserves your attention because of its distinctive characteristics. Unlike typical stomach discomfort that fluctuates with meals or stress, pancreatic cancer pain appears in the upper abdomen and often radiates to the back. Its persistent, progressive nature differentiates it from common digestive issues. The pain follows recognizable patterns worth monitoring. Many patients experience discomfort that worsens after eating or when lying down. This is your loved one's body communicating something important. Over-the-counter remedies might provide temporary relief, but won't resolve the underlying issue as they would with common digestive problems. Pancreatic cancer pain typically intensifies gradually over weeks or months, rather than appearing and disappearing erratically. Your loved one might attribute this to aging, but recognizing this pattern early can bring both initial fear and ultimately relief through timely intervention. Many patients experience this abdominal pain for several months before receiving a proper diagnosis, significantly impacting treatment options. If your loved one describes stubborn upper abdominal pain that radiates to the back, particularly if it's becoming more frequent or intense, seek medical evaluation promptly. The connection between abdominal pain and pancreatic cancer becomes even clearer when we examine what happens to digestion. Most people know what upset stomach feels like, but few realize that when the pancreas is compromised, it creates a distinctive pattern of digestive problems that behave differently from common gastrointestinal issues in ways your doctor needs to know about. When Robert developed persistent digestive issues, his family tried drugstore remedies for weeks, unaware that his symptoms indicated his pancreas was losing its ability to aid digestion. Think of the pancreas as a digestive factory, producing essential enzymes that break down fats, proteins, and carbohydrates. When this factory malfunctions, proper nutrient absorption becomes impossible, regardless of diet quality. A revealing sign is a change in stool appearance, specifically stools that appear fatty, have a particularly foul odor, and float in the toilet can indicate steatorrhea. This condition signals that the pancreas isn't producing enough enzymes to process fat properly. These digestive symptoms typically don't respond to usual remedies. While antacids or dietary modifications might help common digestive problems, pancreatic-related symptoms often persist despite these interventions. As a caregiver, document any persistent nausea, vomiting, or unusual changes in bowel habits, especially when standard treatments fail to improve symptoms. Bring this documentation to medical appointments, as these observations provide valuable diagnostic information that could lead to earlier intervention. While those digestive symptoms aren't the only way your body communicates trouble, there's a more subtle change that caregivers frequently miss: the gradual disappearance of appetite. When Dorothy's husband stopped enjoying his favorite foods and began pushing away his plate half-finished, she attributed it to aging, not realizing his body was signaling a critical health issue. What makes this symptom particularly concerning is how easily it's dismissed. Statements like, "He's just getting older," or "It's probably her medication," prevent further investigation, leaving caregivers confused as they watch their loved one reject once favorite meals. In pancreatic cancer, appetite loss manifests as fundamental changes to taste. Foods that once brought joy may suddenly taste metallic or unappealing. Many patients experience persistent fullness after just a few bites, transforming meals from pleasure to chore. This appetite loss can evolve into cancer cachexia, a complex metabolic syndrome. Imagine a car with fuel but a broken engine. Similarly, even when patients eat enough calories, their bodies cannot utilize these nutrients. This leads to muscle wasting that diminishes quality of life and weakens the body's defenses. For caregivers, objective monitoring is crucial. Keep a food diary, noting quantities and reactions to favorites. Watch for consistent patterns rather than isolated incidents. Document meaningful changes like unfinished meals or sudden aversions to certain textures. Beyond tracking nutrition patterns, there's another objective measurement that could be sending an urgent message: blood sugar levels. When 72-year-old William was diagnosed with diabetes, his family accepted it as an inevitable part of aging. What they didn't realize was that this new condition might actually have been his pancreas signaling distress about something far more serious. While some warning signs require subjective observation, blood glucose provides measurable evidence of bodily changes. When diabetes appears suddenly in someone over 50 who lacks typical risk factors like obesity or family history, this development could be an early warning signal of pancreatic cancer. Research shows that new-onset diabetes can appear 6 to 36 months before a pancreatic cancer diagnosis, making it one of the earliest detectable warning signs. The biological mechanism is straightforward. Tumors affecting the pancreas can impair insulin production, resulting in elevated blood glucose levels. This connection is particularly valuable because it's objectively measurable through routine blood work. Unlike subjective symptoms such as pain or fatigue that might be dismissed, blood sugar abnormalities provide concrete evidence of change, giving healthcare providers an opportunity to investigate before other symptoms emerge. To be clear, not every senior who develops diabetes has pancreatic cancer. However, experts recommend that older adults who develop new-onset diabetes, especially without typical risk factors, should undergo further investigation to rule out serious underlying conditions. While some symptoms of pancreatic cancer involve complex internal processes, there's one warning sign that manifests right on the surface of our bodies. That persistent itching without any visible rash might seem like a minor nuisance, but it could actually be your body's way of signaling a serious obstruction deep within. When Mrs. Peterson couldn't stop scratching despite trying various lotions and antihistamines, her family assumed she was experiencing dry skin or an allergic reaction. In reality, her itching stemmed from inside, a pancreatic tumor blocking her bile duct. This blockage caused bile salts to accumulate in her bloodstream, circulating throughout her body and irritating nerve endings in the skin. What distinguishes this type of itching is its characteristics. It typically affects the entire body rather than just one area, often intensifies at night, disrupting sleep, and most tellingly, doesn't respond to usual remedies like moisturizers or antihistamines. Many healthcare providers might not immediately connect persistent itching to pancreatic issues, especially when it appears in isolation. If your loved one experiences unexplained, widespread itching that persists, consider requesting a blood test to assess liver function and bile salt levels. This could differentiate between harmless itching and something requiring immediate attention, potentially catching pancreatic issues at an earlier, more treatable stage. Fatigue might seem like a natural part of aging, but there's a profound difference between normal tiredness and the kind that signals something seriously wrong. Unlike ordinary exhaustion, cancer-related fatigue doesn't improve with rest. Instead, it steadily worsens, stealing vitality day by day regardless of how much sleep they get. When James's wife noticed he could barely make it through the day without multiple naps, she assumed it was age catching up with him. She had no idea his exhaustion was actually his body's response to fighting cancer. This is a pattern I see repeatedly in my practice: profound fatigue dismissed as getting older when it deserves medical attention. Pancreatic cancer-related fatigue functions like a battery with an invisible leak. Energy drains away regardless of how often you try to recharge. The body's immune response to cancer demands significant energy. Meanwhile, the disease compromises nutrition through multiple pathways. When the pancreas isn't functioning properly, crucial digestive processes falter. Nutritional deficiencies develop, compounding energy problems in a dangerous cycle. For caregivers, this distinction is critical. Pay attention when someone previously active becomes consistently exhausted without explanation. This energy shift can be one of the earliest noticeable symptoms, especially when it follows a progressive pattern rather than fluctuating with activity. Treatments like chemotherapy can further exacerbate this fatigue, adding another layer of exhaustion that weakened patients must navigate. Beyond the crushing fatigue we've discussed, pancreatic cancer sometimes reveals itself through an unexpected messenger in your bloodstream. When 65-year-old David developed a blood clot in his leg with no apparent risk factors, his medical team recognized this warranted further investigation. Their decision to look deeper led to a surprising discovery: pancreatic cancer caught at a stage when treatment options were still viable. Blood clots typically form due to immobility, recent surgery, or genetic factors. However, these clots can serve as an early warning system for pancreatic cancer, appearing before traditional symptoms develop. Pancreatic tumors release substances into the bloodstream that increase coagulation, making blood more prone to clotting without typical risk factors present. Medical professionals call this Trousseau syndrome, a condition where unexplained clots signal underlying malignancies, with pancreatic cancer being a common cause. This relationship between blood clots and hidden cancer has significant implications. Medical guidelines recommend that when patients develop unexplained clots, healthcare providers should consider screening for underlying malignancies. A notable percentage of patients with such unexplained clots are eventually diagnosed with pancreatic cancer, making David's case far from unusual. For caregivers, unexpected medical events require vigilance. If someone in your care develops a blood clot, particularly in the legs, deep vein thrombosis, or lungs, pulmonary embolism, without clear explanation, ensure their healthcare team conducts a comprehensive evaluation that looks beyond the immediate issue. Just as vigilance for unexpected blood clots is crucial, our bodies have another built-in alert system that shows up in the most private moments of our day. When Ellen noticed her husband's urine had darkened to the color of tea while his stools had become clay-colored, she didn't dismiss these changes as insignificant. Instead, she mentioned them during a routine doctor visit, a simple observation that potentially saved his life through early detection. Most of us rarely examine what happens in the bathroom. We typically attribute changes in stool or urine color to diet, hydration, or medication. However, these bodily functions serve as valuable diagnostic windows. The combination of dark urine and clay-colored stools is especially meaningful. This distinct color pattern signals bile flow disruption, often caused by a pancreatic tumor pressing on the bile duct, preventing bile from reaching the intestines. These symptoms are particularly valuable because they're objectively observable, unlike subjective symptoms such as pain or fatigue. They persist regardless of diet and typically worsen over time, distinguishing them from temporary changes caused by foods or medications. For caregivers, documenting these changes is essential, even if uncomfortable to discuss. When monitoring someone's health, immediately report when urine appears dark or stools remain persistently light-colored. These observations warrant prompt medical evaluation and could lead to life-saving early detection. Throughout our journey examining the warning signs of pancreatic cancer, we've seen how this disease often hides behind symptoms easily attributed to aging or common ailments. As we conclude, I want to emphasize the irreplaceable role you play as a caregiver in this detection process. Your consistent presence gives you a unique perspective that even medical professionals don't have. As a caregiver, you are the hero in early detection. Document changes systematically. Be specific with healthcare providers about your observations, and trust your instincts when requesting thorough evaluations. Your vigilance could mean catching the disease while treatment options remain viable. By taking action today, you become your loved one's most powerful advocate, transforming their chances in the fight against pancreatic cancer.